Hi, so today we'll continue our discussion about alcohol consumption and alcohol misuse. So, in two previous videos, part one and part two, we were talking about alcohol consumption in the UK. We've been through some data sources and statistics about alcohol in relation to different parts of the UK. Um, in this tutorial, also continue looking at alcohol consumption data. So um, now we're looking at data from World Health Organization. So Health Organization is providing data across different topics and across different countries. Let's first look at a brief summary, or let's say key facts. So even say May 2022, that doesn't mean that the data is fresh, or let's say more recent. So what they have the harmful use of alcohol is a causal factor in more than 200 disease and injury conditions. Worldwide, 3 million deaths every year result from harmful use of alcohol. This represents 5.3% of all deaths. Overall, 5.1 of the global burden of disease and injury is attributable to alcohol, as measured in disability adjusted life years. Beyond health consequences, the harmful use of alcohol brings significant social and economic losses to individuals and society at large. So you cannot just limit the impact of alcohol on health conditions and health issues. Also, looking at the said impact on the society, the community, families. Alcohol consumption causes death and disability relatively um, early in life. In people aged 20 to 39 years, approximately 13.5 of total deaths are attributable to alcohol. There is a causal relationship between harmful use of alcohol and range of mental and behavioral disorders and non-communicable conditions and injuries. So, looking at the larger impact of alcohol on behavior and mental. So it's not like looking at saying the harmful use of alcohol lead to death. Not only that leads to saying impact on 200 disease and injuries, also the impact on family and the society. Um, um, Factors affecting alcohol consumption, looking at socioeconomic status again. So that's very important. Also looking at policies and um, um, law enforcement in relation to um, age restriction and also in relation to taxes, how cheap it is, how affordable it is, how, let's say, accessible. Um, we need to remember also that um, the burden of alcohol, let's say the damages that alcohol can cause, it's not only about the person himself or herself, also about the country, the burden in terms of um, all that, let's say, consequences in terms of, let's say, monetary consequences, or let's say that would be in terms of the treatment, in terms of, let's say, support. Um, so all of that. Uh, so all these health issues, conditions um, treated in, let's say, health facilities that will be paid from the taxpayers money. So in this case, um, there should be um, something to compensate for these losses as well. Like in the UK, we have heavy taxes in terms of alcohol and tobacco. So other countries, so you need to look at in each individual country, the case of each individual country separately to know, let's say, why there is a high consumption of alcohol, also to look at the death rate. Okay, so in terms of data, if you try to search the database of World Health Organization, you'll find many series of data in terms of tourist alcohol consumption, alcohol total per capita consumption, and recorded per capita consumption, also level of consumptions, recorded per capita consumption, alcohol drinkers only, total per capita consumption. So you'll find national surveys on adult alcohol consumption. So you'll find plenty of data, but what we're looking at today, looking at only briefly alcohol total per capita, 15 plus consumption in liters of per alcohol. So we're looking at here saying, so this is interactive chart. So this is very good to show you different part of the world. But the more recent data that we have here saying 2019, but if you look at the data and you're trying to select is the latest can give you, so I'm not sure if the latest is 2019, but uh, so we have 2018 latest. I'm not sure if latest 2019. Uh, so it's still not up to date data. We don't have any data about the um, COVID era yet, um, but it's still important. So you're saying 2019 alcohol consumption in the world measured in liters of pure alcohol per person of 15 years of age or older was 5.8 liters, which is a 5% relative decrease from 6.1 liters in 2010. So if you look at the world consumption of alcohol, you would say that in dark blue, you see is greater than 12.5 liters, and then very light blue, we're saying less than 2.5 liters. So as you can see here, the darkest area, you see Russian Federation and also Australia. Coming to Australia, also we have Germany. You'll have here Spain. You'll have a little bit darker Tanzania, uh, Ireland. Uh, yeah, so you see here lighter now talking about Canada and United States. So that one thing to look at the overall consumption in the world in terms of alcohol. So it's interactive, so you'll be able to look at different countries' territories, so you can have an idea about what are the causes or what factors you need to consider if you're going to do research about alcohol consumption, alcohol misuse. So that will give you an idea about uh, what could be the factors, important factors or significant factors that you could think of. Also, you need to consult the literature as well, but this map will give you a clue about what's going on. Okay, I'm not going into this in more details, rather than I'm going to move on to our world in data, alcohol consumption. Um, so there will offer you some kind of interactive charts about alcohol consumption uh, by tourists. So that's um, yeah, World Health Organization data. Uh, Also, you be able to see National Institute on Alcohol Abuse and Alcoholism. Um, so alcohol use in the United States. So uh, prevalence of drinking. So looking at 2019 National Survey on Drug Use and Health, 85.6% of people aged 18 and older reported they drank alcohol at some point in their lifetime. So United States, 85.6%, over the 18. I don't know why I'm looking at over the 18, but anyway, so 85.6% they had alcohol. 69.5% reported that they drank in the past year, and 54.9% reported they drank in the past month. So again, we have a high percentage of drinking across gender, looking at men drinking slightly more than women in terms of drinking. Uh, Binge drinking and heavy alcohol use, 25.8% of people 18 and older reported they engaged in binge drinking in the past month. So that's heavy drinking. Yeah. So it's 25.8%. What is it? Alcohol use disorder in the United States. You have 14.5 million people age 12 and older had alcohol use disorder in 2019. So we're looking at um nearly 15, or let's say 14.5 millions. Um, so in relation to the whole population of the US, again, so you need to take a population as a control variable here to be able to see how significant it is in comparison to other countries. Youth ages 12 to 17, estimated 414,000 between 12 to 17 years old had alcohol use disorder at that age. Okay, treatment of alcohol use disorder in the United States is say that 414,000. Yeah, we're talking about that. Less than 10% of people receive treatment in the past year. So that's something needs more attention. Okay, alcohol-related emergencies and death in the United States. So we have 95,000 people die from alcohol-related causes annually. We need to look at the rate. Yeah. Okay, at 18.5% of ED visits and 21.5% of overdose deaths related to the prescription an estimated 95,000 die, approximately 68,000 men and 27,000 women, making alcohol third leading preventable cause of death in the United States. So the first one in the United States is tobacco, and the second one, poor diet and physical inactivity. Now, talking about economic burden in the United States. So misuse costs the United States, guess how much? 249 billions. So that of, again, taxpayers' money, 249 billions. So that's the economic burden of, let's say, alcohol misuse. 3/4 of the total cost of alcohol misuse is related to binge drinking, so heavy drinking. Now we're making some comparison with the, let's say globally, I was saying 2016, so still that data is old, but again, I'll give you some clue. 3 million people died after alcohol misuse. So alcohol misuse was the 7th leading risk factor. Oh, 2018, World Health Organization reported that alcohol contributed to more than 200 disease and injury-related health conditions. Consequences of families United States, saying around 10.5% of US children aging 17 and younger live with parents with alcohol use disorder. Underage drinking in the United States. So it's difficult to get data about underage drinking. Prevalence of drinking according to 2019, 39.7% of 12 to 20 years old reported that they have had at least one drink in their lives. About 7 million people between 12 to 20 reported drinking alcohol in the past month. 4.2 million people, between 12 to 12 and 20 years old, reported binge drinking in the past month. Wow. So prevalence of heavy alcohol use according to 2019, approximately 825,000 people between 12 and 20 years old reported heavy alcohol use in the past month. This represents 2.2% of this age group. Okay, there's a lot of that, but we need to move on. So we have here got that from WTO, so talking about average liter per year drinking and this about the US again. And top countries again, 2019. Top countries: Czech Republic, Latvia, Moldova, Germany, and so on. Top countries with the that's interesting. Top countries with lowest alcohol consumption 2019. We have Somalia, Bangladesh, Kuwait, Mauritania, Saudi Arabia. So there's Muslim countries. You got zero. Afghanistan, Libya, Yemen, Egypt, Syria. Uh, so Bhutan, Indonesia, Pakistan, Djibouti. So these majority Muslim countries. So the slowest consumption. That's factor. I'm saying Muslim countries because that's something in relation to culture, religion. Okay, moving on. We have World Health Organization Global Information System on Alcohol and Health. So harmful use of alcohol, 3 million people died globally in 2016. Alcohol consumption, 57 of adults um, abstained from alcohol in the past 12 months. National alcohol policy, 46% of member states reported having one in 2016. So you have some research and publications about alcohol. We're going to look at World Bank as well. So if you're looking at data, so what World Bank will do, so if you go to the, as I showed you in the previous video, so you can go to data bank and you can look at these indicators. So total alcohol consumption per capita, total alcohol consumption per capita male, number of yeah, so you'll get similar data to World Health Organization. We have also OECD data. Alcohol consumption is defined as annual sales of pure alcohol in liters per person aged 15 and older. So that's the definition of World Health Organization. Okay, so what we have here, we have this chart showing you alcohol consumption 2021, so that's more recent, and they showing you the countries. So now we see that 2020, so we have the highest countries. See the table. Our table does not show them in order. So for the screen, yeah. So you have highest. We're looking at Eastern Europe. So Latvia, Czech Republic, Lithuania, Austria, Bulgaria, Romania, Poland, Luxembourg, Russia, Germany, Estonia. So United Kingdom is in here. Yeah. And then you go move on. You'll see that Indonesia was so with a great population is like consumption is very low, extremely low. Okay. So that in terms of countries with the huge let's say alcohol consumption. So we have alcohol focus Scotland. Hundreds of alcohol campaigners, researchers, health professionals, policymakers from all over the world will gather in Edinburgh for the Global Alcohol Policy Conference. So it's good to know that there are some people who are working towards um, formulating policy that will save more life and improve, let's say, reduce alcohol consumption. Uh, okay, so 3 million people, 3.3 um, million deaths annually worldwide is something. So you could compare that with other death causes, and you see that it's huge. Okay. We have also alcohol facts. Okay, that's within the international. So it's a charity where they looking after uh, help people in terms of health issues. Okay, key facts. Disseminating alcohol facts. Yeah, alcohol is a toxic substance in terms of its direct and indirect effects on a wide range of body organs, and is a causal factor for more than 200 disease and injury conditions. So we've been through that before. Alcohol consumption causes death and disability relatively early in life. We've been through that before. Um, what else? Approximately 2.2% of global adult population, um, meaning around 164 million people, suffered from substance use disorder in 2016. So we're looking at 164 million people talking about alcohol use disorder. Um, Global facts. Alcohol use results in significant health, socio-economic, and human rights burden on society at large. Alcohol kills 3 million people worldwide. We know that so far. 200 diseases. So the problem with alcohol is something you could prevent. So in this case, you could provide a support and awareness. In this case, you could prevent the death. It's not something is totally out of control. In relation talking about policymakers and the government and uh, the society. Yeah, so economic burden for alcohol worldwide is substantial, according for up to 5.44% of gross domestic product in some countries. Okay, so we'll continue with this series, um, and we'll look at more data and more facts about alcohol consumption, alcohol misuse, and we'll look at so far we've been through many data sources about alcohol data. We've been through different let's say global bodies and charity in terms of data, in terms of figures, locally and nationally and internationally. We'll continue with that, and now you'll have more knowledge, more information. Hope the image is clear now. I will continue with that in next videos. Um, Hope this is helpful. Thank you.